Hi Baxter Brainer, this is Dr. Remmick with Healthsource of Baxter, and I just had one question for you this afternoon, is do you have a Psoas? It's kind of a funny joke. So when we look at this picture, we all have Psoases. We actually have 4 specific ones. We have a Psoas minor and a Psoas major, and we have 2 on each side, so that's 4. And so what I want to talk to you guys about today, this is a really common thing that we see with patients in the office that can lead to a variety of symptoms. And so as you can see, this is what a spine would look like for somebody laying here. Somebody used the spine to explain what that actually looks like. So when somebody has problems with their psoas, the psoas pulls from here down into their leg. And what happens if the psoas is too tight on one side, what happens is the spine gets pulled this direction, and a lot of times can actually compress these nerves or pinch these nerves and lead to radiating pain or something that you've heard called sciatica, pain that goes into the leg. And it can cause pain on one side, and sometimes when it pulls forward, it can cause pain on both sides. And so what we want to talk about today about different solutions for psoas problems. And so I'm going to walk you guys through a specific stretch that we do many times with patients to try to help with some of these symptoms. So I'm going to step around our patient here. And remember, the psoas is right in the front of the thigh groin area here. So what we do to test it first is we'll bend the leg up. And then to test it, we hold the pelvis down, and all we're doing is lifting up to see how far it stretches, right? And this isn't very flexible, so this one needs some work, and we'll talk about that in a second. We're going to test the opposite side. And you can see this one actually gets raised up higher, right? So we're going to work on this right side, and I want you to see what we're doing is something called post-isometric relaxation, and it's going to help. One of the things that we do for our patients in the office, just to see how we can actually loosen some of these areas up. Now, this does take 2 people, meaning an examiner, doctor, person, as well as a patient. Obviously, you can't do this on yourself. And so how we're going to do this is I'm going to raise this up, and all I'm going to have her do is just push down with her leg down towards my hand with about 40 to 50% of her strength, and I'm just going to resist it while she holds it there. So can you push down for me? Just hold it there. I'm going to do that for about 10 seconds. And then relax. We're just going to let it relax for a moment, and then we're going to raise it back up and look at the flexibility. Now, if you can see, the leg comes up quite a bit higher compared to where it was. Usually we'll do that 2 or 3 times. We're going to do it one more time again. I want you to push towards my hand. And remember, it's only about 40% of strength. And then relax for me. I'm going to bring that down. And then as I bring it up, you notice the difference in flexibility you can see there? Huge difference. Now, sometimes we can't do this to ourselves, obviously, so we have to do it on our own. So I'm going to teach you a quick way to do it at home. All we're going to do, grab a little mat. And you're going to get down on one knee, sometimes easier with shorts, but we just got dress pants on today. And all I'm going to do is get into kind of a lunge position. I'm going to lean forward, and a way for me to get this area stretched the most, I'm also going to use my arm and just reach up towards the opposite side. And I'll feel a big pull right in through here. And with this type of stretch, you're just going to hold it for about 30 seconds. Then we're going to move to the opposite side to stretch the opposite psoas. Bring it forward, feel a pull here. I'm going to reach. Now this side is not as tight as the other side, so my right side needs a little bit more work comparatively. Alright, so this is just one simple thing that you could do if you're starting to have some lower back pain. If you have questions on what else could I do to help with my symptoms, or if you're wondering, is the psoas even a problem for you? Reach out to us, give us a call. We can get you scheduled for a consultation. If you know of somebody that has back problems that could use some help, send them the link to this video, or just share the post and try to spread the word on ways we can help with back pain.